suffer from nagging back pain? Chances are the nerve-rich facet joints on the backside of your spinal column are damaged and need treatment, or even worse, the discs may be to blame for causing the pain. So what are your options? Well, you can ignore it like many others do, but that's only going to make the situation worse. You may opt for some rest, go for therapy, or take medicine. Now, while they may help alleviate your pain temporarily, they certainly won't address the root cause. Surgery is one of the most dangerous options and should definitely be your last resort. You may be wondering, isn't there anything that is holistic or a more natural solution to this back pain you're having? Actually, there is. With our pain-relieving chiropractic adjustments in your arsenal, you can finally put an end to your back pain once and for all, without needing dangerous surgery or taking medication. Our experienced chiropractors will work with you to help you keep your spine, discs, and soft tissues in the best possible shape and functioning the way they should. What are you waiting for? Contact us today.
Oh, let's see. So tell me, please, what's going on with you?
Pretty much, you want the whole breakdown as far as how it happened, or?
Yeah, just go ahead.
So yeah, I go down to put on my shoe, right? I just got back from the gym. You know, me and my friends, we did legs and stuff like that. So, you know, but I go home. You know, I'm getting dressed, I'm feeling good, I put on my shoe, and then while I'm putting on my shoe, like my left groin type testicle was hurting, right? So I'm like, oh my God, like, you know, like thinking like, okay, maybe I squished it or something when I was going down, right? And I'm like, oh my God, like, oh, this is hurting. So I waited there for about 5-6 minutes. And then it didn't go away, it got worse, and then it went like from here, underneath my leg, all the way up to my back. And I was like, oh, like I couldn't even walk.
Okay.
Like, it was crazy.
How long ago was that? When did it happen?
That was like 2 months ago. And I was dealing with that pain for about 3 weeks. I couldn't even sit down on it.
Okay.
You know, like, and you know, the doctor was like, maybe it's a strain, it's something, you know, everybody's like, trying to figure it out. Like, I'm like, man, these people don't know what they're doing. I don't know. So, you know, they're giving me all kind of pain medicine, all kind of all this other crap. So, you know, after a while, you know, after the spasming, after all the cramps, all that stuff went away. You know, any like pressure, it would get re-ruptured, and then it would start here, and then it would shoot straight up my back.
Okay. So for it happened 2 months ago, and when did you start using this?
Okay, the cane.
To alleviate, to help you with walking?
Actually, this had to be about maybe 2 to 3 weeks ago because I was still dealing with the pain. I was actually on crutches.
Okay.
All right, and then they had gave me some steroid prednisone. And like, I mean, it took a long time for the prednisone to kick in, maybe like a week and a half. Like I was almost done with the dosage.
Okay.
And then it kicked in, and then, you know, I mean, whatever it did, it gave me some strength where I could ditch the crutches and walk on this. But when all the pain and stuff, all the inflammation was going away, I felt a little pinch in there.
Okay.
So it was like, oh man, you know, I was asking my doctor, like, what is that pinch?
Okay.
You know, and then
they didn't know.
They didn't know.
Okay.
You know, they was like, well, maybe it's a pinched nerve, blah, blah, blah. So they finally do an MRI, man, like after 2 months. Like, I thought I had an MRI, but I don't know, you know what I'm saying?
And what did they say with the MRI?
Yeah, so I have my...
You have the disc, or you have the report?
I just have, like, the report.
They did not give you a disc?
Nah, they're supposed to give me a disc?
Well, sometimes they do. Okay. Impressions, mild disc degeneration from L3 to L5 without significant central canal and neural foraminal stenosis. No specific femoral lumbar spine explanation for patients left radicular symptoms. So you have disc problems, and that's what's probably causing the pain.
Right.
A lot of times the disc problem has to do with the SI joint, sacroiliac joint misalignment, because that's causing your spine to torque.
Right.
And that's when your spine is torquing, it's putting more load on the disc, and this starts bulging out. When that happens, it's putting pressure on the nerves, and it creates all kinds of symptoms.
Yeah, cause like it's weird, cause like, I lost some sensation, some tingling happens, man. Like it's crazy, it gets numb. Like I freak out a little bit. Like I pinch myself. Like what's wrong, And then all of a sudden, like it's like this sharp bone in my arch that's like poking me. I'm like, sometimes like I wake up, it kind of goes away, and then it'll come back. And then, for a while, for about 2 weeks, I was sleeping on the floor, like trying to figure out everything I could do to get better, you know what I'm saying?
Okay. Well, let's see what's going on with you. Let's get this thing out of the way.
Yeah.
Sit still. Don't move. Hurts around here?
No, lower.
Right there?
A little left to the left.
Right there?
Yeah. Yeah, that, I felt that in my groin area.
So when I move you to the left?
Yeah.
Okay. Okay. Bend forward, please. Back. Forward again. Okay. Stand up. Turn around. Close your eyes and march in one place. Okay, stop, don't move. And that explains the right side is about 1.5 inches lower than the left side. Don't move. Hold this. Okay, you can take your arm, alright? Move over to the left, please. Give me some space here, too. I want to be in action, too. Okay, so this is you looking at yourself from behind. So most likely what you did, how much weight did you lift when that happened?
You know what? It wasn't a lot. Maybe we did a lot of different exercises, but we did mostly lighter, medium, but we did a lot more reps.
Okay, well.
So about I don't know, maybe about 150.
Okay, wow, that's a lot for me. In any case, when that happens, what happens is that you already had most likely problem with your spine. So when you were loading with your with the weights, your pelvis most likely shifted even more. So the right side of your pelvis is about 1.5 inches lower than the left side. So it's kind of like this. And you see these nerves?
Yeah.
They come from here, from the sacrum, from here. They go down your leg, and some branches go down to your groin area as well, because lumbar spine supplies that groin area and everything around perineal area, everything around that that has to do with the pelvis. Everything is being supplied with the lumbar nervous system. Okay, and sacrum. So as a result, when this is torqued, it's kind of like this on the right, and then the right spine, the right side of your lumbar spine is torqued like this. I can't do it, but it's shifted. So there is no range of motion on the right side. So we need to adjust here and here to make it to make the tension to go away. And spine, when this is torqued out like this, spine is compensating, and then your thoracic spine is shifted to the right, because your right shoulder is about 1 inch higher than the left side, and then your neck is compensating, it's moved to the right as well. Your right is about maybe 0.5 inch higher than the left side, okay? And then your right leg is a little bit longer, it's compensating, it's externally rotated. So you're putting more load on your right leg. Do you feel like you're compensating, you're putting more,
because
you're
for
limping?
a while this one was straining a little bit. I was like, oh man, the other side about to go out.
So what I'm gonna do, basically, what what I do best is
Yeah,
that
for sure.
I'm gonna set you up for heat and stim. We're gonna relax your muscles because they're pretty tight over there.
Mm-hmm.
And then I'm gonna adjust your entire spine, your sacrum, sacroiliac joint, your lumbar, your thoracic, and your cervical spine. Even so, you don't have any symptoms here. It's all interrelated. Okay.
Okay.
Most likely, you're gonna have to come back a few more times to kind of polish it up.
Okay.
'Cause it's been there for a long time, and an inch and a half difference is quite a bit.
Yeah,
Okay.
yeah,
And then let's hope that the goal is to make this go away,
yeah.
right?
Sure, yeah.
Go back to the gym,
Yeah,
right?
yeah, man. I didn't put on weight.
So what we're gonna start right now, right after this, I'm gonna set you up,
Mhm.
and then we'll just go from there, okay? And
Alright.
then after I adjust, hopefully my massage therapist is here, and then she's gonna work on you as well, okay?
Sounds good.
All right. Any questions?
No, let's get it going.
Fix me, let me go. huh?
Yeah.
Alright,
Get me back
sounds
to
good.
normal.
Alright, so how was the massage session?
Very good.
Good.
Very good.
So I'm gonna start with your neck, okay? And just relax. It's a little bit here. Okay. Go ahead, line your stomach face down, please. Take a deep breath in. Out. Yeah, breath in. Out. Okay, breath in. Out. Okay. Now, go on your side, face me, like you sleep on your side. In your hand. Okay. Look towards the wall. Relax. Good. Okay. Sit up. Now, hold on, hold on, hold
Oh,
on.
sorry.
Stand up for a second. Okay. Go ahead, lie on your side. Just along this one. Okay. Relax your shoulder. Relax. Okay, good. Okay.
Was it relaxed?
Yeah. Okay. Yeah. It's good. Okay. Stand on your feet. How does it feel?
Feel looser.
Okay. What was the worst position that was causing the pain? When you're sitting or when you're
Yeah,
standing?
when I was sitting.
Okay, go ahead, sit down. Okay. How does it feel? Can you put the load to the left? Remember I was bending you, it was hurting?
Yeah, it doesn't hurt as you know. I feel like a lot of tension is released.
Released? Okay.
Yeah.
And this way, to the right?
Oh yeah.
It's good?
Yeah.
Okay.
Yeah.
Good. Do you feel like a little bit of warm, like blood rushing in? Is that
Yeah, it feels a little.
okay?
A
What
little-
about your leg? Is that still numb or is that good? Do you feel like you still need this when you walk?
Let's see. Oh look.
Huh.
Nah, I could feel something like that pinching
Uh-huh.
bone. It feel like it's kind of
It's gone?
releasing it. Yeah.
Okay, that's good.
Definitely.
Well, hopefully next time you walk in here without
Yeah.
without the cane.
Yeah, it feels a little looser.
That's good.
Yeah.
We don't want any sticks. We want to get you back to the gym,
Yeah.
get you going. Okay, great. So next time will be Friday. Okay.
Okay.